When it comes to financial health, the state auditor says Kentucky's rural hospitals are in critical condition. Adam Edlin released a report this morning showing 1/3 of rural hospitals face serious financial trouble. It's a major concern when you consider half of Kentucky's population lives in rural areas. The results echo a WKYT investigation we brought you nearly 3 months ago. WKYT's Mark Barber takes a closer look at the results.
The results of a year-long study into the financial health of small community hospitals are in, and the state auditor says the findings are troubling. The special report shows that the majority of Kentucky's 66 rural hospitals are below the national average in financial strength, and 1/3 are in poor financial health. State Auditor Adam Edlin says there are also concerns about maintaining adequate access to health care. In our series of investigative reports last month, Nicholas County officials told us that they think the system is in crisis because rural hospitals are burdened with a greater number of Medicaid patients. Edlin says while the report does not investigate the reasons why hospitals are failing, he thinks one of the biggest problems they're facing is a shrinking private insurance market. According to Edlin, in eastern Kentucky, many people are relying more heavily on government insurance because some employers, especially in the coal industry, are no longer able to provide private insurance. That's a problem because private insurance reimburses above the rate of service, unlike government insurance.
When you see a disappearance of private insurance and a heavier utilization of government insurance, your former business model has to be transformed.
Edlin says if rural hospitals are to survive, they must change, and he says the government needs to facilitate that change. He says he is recommending that the governor convene a task force that will look for new ways for these hospitals to continue providing care, even though it is becoming increasingly difficult to do so. In Frankfort, Mark Barber, WKYT.
Governor Steve Beshear responded to the report this afternoon, saying hospitals received $506 million in new Medicaid expansion payments last year and saw a reduction in uncompensated care costs. He says the report does not show the change to hospitals' bottom lines from that.